Okay, guys, Dr. Tom is coming back. He's here again. Yeah, that's right. Yeah. Last video, I got a little bit grumpy. Started complaining about things. And, I feel like I had a right to, so what? It could have been part of it to do with cancer, guys. I ran out of time. We're almost finished, actually. We only had like 3 slides left, and 2 or 3 of those were the ones where they ask a question. Let me just say this about cancer. I lost my grandmother to cancer, my grandfather to cancer, my mother to cancer, my wife to cancer, and my son to cancer. So I know a little bit about it. Never been a patient, but I've been there and seen what they do and been through it. It's not fun, guys. It's not fun. I think they need to look in other directions for treatment. Okay, radiology, nuclear medicine. Now, some of this actually you're going to have some fun with because it's got pictures of some weird x-rays in here. X-rays are great. They were discovered in 1895. They show bones and fractures and joints and things like that really well. What they don't show well is soft tissues, but there's other things like MRIs now that do. So radiology is the medical specialty concerned with the study of x-rays and medical imaging. Now we have to say medical imaging because at one time it was just x-rays, but now it's MRIs and CAT scans and ultrasounds and all sorts of things. X-rays are invisible waves of energy. They're actually light, guys. So are radio waves, so are TV waves, so are microwaves. They're all light. But they're, in the case of x-rays, they're much higher energy than the visible light that we see. Nuclear medicine, use of radioactive substances in the diagnosis of disease. Fluoro means something like fluorescent lights, luminous. Iso means same. Pharmaceutical means a drug. Radio means x-rays or radiology. So radiology is a specialty of interpreting these x-rays and other diagnostic imaging. The doctors that do that, they read x-rays all day rather than, treat coughs and what have you. Rankin is an old term for x-ray because the man that discovered Conrad Rankin, that was his name. A sono is sound. Sonogram is like ultrasound. Therapeuto means therapeutic. Vitro means in glass. Vivo means in the body. And these two are important to know. So in vitro fertilization is where they take the eggs and sperm from the parents and combine them together in a dish and try to promote fertilization to occur, and then they implant that back into the uterus. Vivo means inside the body. Vitro means in glass or a container. Usually it's glass. Those are important terms. Gram means to record like an EKG. Graphy means the process of recording. Lucent means something that shines. Opaque is something that doesn't shine. So something that's radiolucent shows up clear on an x-ray. Something that's radiopaque, like fillings in your teeth, show up pure white. They are radioopaque. Cine, movement, cinefluoroscopy is moving x-ray. Echo, they use echocardiology, look at the chambers of the heart. Ultra beyond, ultrasound, use high energy sound waves to visualize. Most of you will know it from what they do with pregnant women. Okay, radiologist, medical doctor who interprets the images. Okay, nuclear physician uses radiation for diagnoses and treatment. Radiologic technologists assist with x-rays, ultrasound and stuff. The x-ray techs are real good, guys. They're the pros that take the x-rays. Okay, they actually expose photographic plates just similar to a photograph. But the difference is x-rays can penetrate things and go through them and show up on the film. The x-rays themselves are invisible. They travel in straight lines. Sometimes they produce scatter, which is can be somewhat harmful, but there's ways of cutting back on scatter. One is they collimate the film down. And sometimes low energy x-rays can knock electrons out of the outer shell, the valence shell of atoms, and produce ionization, which can damage tissue, which can be dangerous. However, now, guys, this is a science and art that they've been working on for decades, and they're real good at it. And they've got it down where it's really, really safe. The minimal amount of radiation necessary to see what they need. Now, let me say this. It's all, nowadays it's all done digitally. So you can email x-rays back and forth. But in my day, when I was taking them, we actually had a dark room with a light-proof bin with a film in it and light-proof housing, and you had to work under a red light so it wouldn't expose it, just like photography. But those days are behind us now. It's all done. It's all digital now. Diagnostic techniques, x-ray studies, digital radiography. Most x-rays are, see what I just said. Yeah, the vast majority. Now, a CT scan or CAT scan is computed axial tomography, if you want to say the A. It's basically taking a series of x-rays with a machine that goes around like this, and then the computer is able to put the images together and show soft tissues. And that's, so in fact, it produces, they actually have done this well. A super x-ray series, they can see soft tissues. Great. Sometimes they have to inject or have you drink or take an enema of a substance that causes contrast so they can see this stuff a little better. That's what contrast studies are. Substance is added to the body, usually by IV, but like if they're wanting to see the esophagus or something, you swallow it. If they're wanting to see the colon, you get it up the butt. Fluoroscopy is a moving x-ray. Really interesting. So it's an x-ray except you see them moving. It's used in a lot of different stuff. Digital imaging technology, interventional radiology. It's the ultrasound. Use of high-frequency sound waves to create an image. Great stuff. Just, like the ones where they look at the fetus. MRIs are amazing. They don't use x-rays at all. They're not radioactive at all. They use high magnetic fields and radio waves. Magnetic imaging or magnetic resonance imaging. They used to call it MRI. Now they're calling it more an MR. But like I said, and it also shows soft tissues and stuff. Okay. Here they're taking a chest x-ray. The film, or whatever they got. See, I don't know how it's done now that it's digital, but used to they have film in this thing right here. It's called a bucky. Patient stands up against it. The tube is back here. The x-ray goes through the posterior to the anterior and exposes the film. That's why it's called a PA view. Chest x-rays are taken from P to A. Spine are taken from A to P. Why? It just works best that way. Here's an A to P view of the thoracic spine. Lateral view. You always have to have at least two views, guys, and they have to be at 90 degrees to each other. So you take an A to P spine or a PA chest, you got to take a lateral. And in order for the arm bones to not show, which you don't want, you have to have them raise their arms up. That way, and this actually the person would be right up touching the film. This is called the objective film distance, and this would mess up the x-ray. It's too far. You actually have to be right up against it. Sometimes you got to have them in an oblique angle in order to see certain structures. So that's what this is, taking an oblique view. So the patient is at an angle into the film and then taken that way. Certain structures have to be angled to be able to see them. X-ray positioning, this abduction movement. Well, we all know what those are. Those sense of going. It's important, but if you don't know them yet, you're behind. Decubitus lying down the side, recumbent lying down, prone lying in the bed, supine. We know all that. Now, guys, you don't go to a patient and say, "Okay, now, Miss Smith, we need you to lay down in a decubitus position for us." Okay? No one's going to know what that is. But I mean, it helps for you to know. Nuclear medicine, radionucleotides, radioisotopes, radioactive particles of gamma rays used to visualize tissues in the body. Here's in vitro and in vivo. Remember what those are. That's important. In vitro procedures, analysis of blood and urine. Sometimes they do radioimmunoassays, guys, where they inject radioactive substances in the body, special kinds, and they can track it that way. For example, the thyroid, they can take radioactive iodine because the thyroid uses iodine to make T3 and T4. It can kind of give an idea how the thyroid's working. In vivo, well, that's in vitro, and in vivo is in the body. Here's okay, that's what I want to get to. Let's see. There's also several other different types of medical imaging. Bone scans use radioactive PET scans use positrons, which are positron emission is actually antimatter, guys. They use it. Yes, they do. We talked about CT scan, single photon emission computed tomography, SPECT, thallium. See, here's thyroid scan with radioactive iodine. All right. Yeah. So you thought I'm making all this stuff up as I go. Look, it's like I've never seen it say that before. Only I said it. Antimatter. Positron is a positive electron, just like in Star Wars and Star Trek. And yeah, man, they're actually using antimatter. I don't know how it works without annihilating. Well, intravenous injection, concentrated radical tracers, or the PET scan. PET scans are real expensive too. What they do, guys, is my son had to have a couple of PET scans, and they inject radioactive glucose, and cancerous cells or infective cells suck up that stuff faster. So on the PET scan, that you'll see little areas glowing, and that's where it is. So that's what it's used to. The problem is it only shows one down to a certain size, and it's still pretty big. SPECT, I've seen this, but I don't actually know what that is. I know it's a single photon emission computed tomography, but see, what does it say? Detect liver tumors, cardiac ischemia, which is a lack of oxygen, disease of bone and blood. Okay, bone and spine. All right, here's the X-ray, man. Guess what that is? That's the ring. They forgot to take it off. This guy forgot to take the nail out of his head. No, somewhere or another. This is a lateral skull film. That is a nail, guys. Now, the denser an object is, the more white it shows up on X-ray. So metal shows up as pure white. Fillings in the teeth, too. So this dude, yeah. Now, we'd have to see. This is why you have to have an A&P view, too, to see where that nail is located at. Here's a pair of scissors that was left inside this person, evidently. That's inside them. So evidently after surgery, big no-no. Somebody's going to get their butt suit off. Left those surgical scissors inside this patient. That's their pelvic area. This dude, I don't know if he lived or not, but these are all nails, guys. Evidently from a nail gun. See, this one's going away from us, going that way. I can't conceive of him being able to survive that many nails in him. Because look, they're going 2 or 3 inches into his brain. So I can't see he survived that. I don't know what this is. But I'm going to tell you, it's very near to somebody's butt. And it's metal. Or maybe, no, this is I think this is a male, yeah. Here's the shadow of the penis right here. So he's been doing something naughty, or else he sat on something accidentally. Which, of course, that's always what they say, guys, when they come in. Oh, I sat on this, and like this Coke bottle. This might be a female. I can't see it. But this, guys, this is a little Coke bottle. It's either in the rectum or the vaginal orifice. I think it's the rectum. So I'm sure that this patient told him, I sat down accidentally on this Coke bottle. Of course, what would be the other possibility, guys? Well, I'll let you imagine, but I would say they're just a little bit kinky. Now, these are keys impaled in this guy's head. My God. Why are they white? Because they're metal, guys. They're metal. It's like a negative. The more dense something is, the whiter it is. Look at this. A knife in his skull. My God. Here's the A to P film. Here's the lateral film. The eye sockets, nose, mouth. Here's the ear. So I don't know. I'm assuming he's still alive. It looks like it's way over to the side and didn't get deep into the cerebral hemisphere. So he probably, I would say, would survive this. Oh, here's a badly broken foot. Badly. These are the toe bones. Here's your little toes, big toe. This might be I think this is a disease process. They're missing something here altogether. But the way this looks, this is a disease process. Could be rheumatoid arthritis, something like that. Or psoriatic. It tends to look like that. We're running out of time. Here's another journey in the butt. See somebody again in the butt. Yeah, that's what it is. I know what you're thinking. My God, how can there be such people in this world? Oh. Okay, now this is a completely dislocated spine, guys. Not good. Here are the rib cage. Here's the hip bones, the sacrum, completely dislocated. Oh, badly, badly mangled hand. Okay, we're going to stop at this one. We'll pick this up when I come back, as I'm out of time. I'll be back.